Hi, it's Brian Heaberlin here with Lexington ENT and Allergy, and I'm going to talk about an ear infection that's a little less common, but still something we see fairly regularly here in South Carolina, and that's fungal otitis externa. So most ear infections of the outer ear canal are swimmer's ear, or usually it's a bacterial infection of the outer ear canal. And there's common antibiotic drops that are prescribed that help with that bacterial otitis externa or swimmer's ear, even though many times it's not related to swimming at all. But there's another kind of infection that many times gets misdiagnosed, or there's certainly a delay in diagnosis, and that's fungal otitis externa. So funguses float in the air, their spores do, and they can land in our ears and start an infection. Funguses like to live in areas that are dark and moist and warm, and our ear canal kind of fits all of those criteria. Once fungus gets in the ear, it's often pretty difficult to get it to go away. Now, fortunately, it's not terribly invasive or a big deal, but it can cause the ear to be stopped up or blocked up, and you can't hear well, and many times there's itching with it. With the more bacterial otitis externa, or infection of the outer ear canal, those are usually very painful. And with those, it often hurts just to wiggle or move the ear. But the fungal otitis externa, usually it's more of an annoyance and plugged up thing, and you can flush it out and it opens up and then it comes right back. Sometimes they're misdiagnosed as just recurrent cerumen or wax impactions that come very frequently. When it's not that, it's really an infection growing in there. The biggest thing to treat these fungal otitis externas is to clean out the material and really kind of suction out or scrape out as much of that as you can. So here we use an operative microscope and suctions, and we really clean out everything very, very thoroughly. We then typically apply a powder to the ear canal that helps dry things, and it also changes the acidity, and there's some antifungal and even some steroid medications that kind of help kill and improve the ear canal. Now, sometimes it takes 2 or 3 clean outs and applications of that powder to get things to work. I often will use some Lotrimin drops and have found those to be very helpful. Some things that people can try on their own at home is an alcohol and vinegar mixture. So if you take half white vinegar, half rubbing alcohol, put it in a little ear bulb syringe and flush the ears out, that can help change the pH a little bit and clear out some of the stuff and dry things out, which can sometimes allow the fungal otitis externa to get better. So to summarize, in the South, we see these fungal otitis externas more so than we do in other areas. The humidity often contributes to that. We definitely do see things a little more so over the summer months when we have sweat and moisture in our ears, and fungal otitis externas are often misdiagnosed and can be a little trickier to diagnose and treat. A fungal cell is actually a lot closer to a human cell than bacterial material. So those things, the point in that is that we don't have as many medications to exploit those differences, and that's one reason why we just don't have the good antifungal type drops. So we can, we rely more on cleanings and drying and changing the acidity. So if you have a chronic stopped up ear that itches, really if you have any ear, nose or throat problem, we're happy to see you here at Lexington ENT and Allergy. But specific to this discussion is if you have that itchy ear, it's often plugged up, and you've been on a bunch of different drops by your primary doctor or urgent care, and you're not getting better, certainly a fungal otitis externa could be a consideration, and we're happy to take care of you here at Lexington ENT and Allergy. Thanks. Hope this is helpful. Bye.